What's up guys, Dr. Chad with Energy Physiotherapy and Nache today, talking about one of my favorite topics, ice. We're going to talk a little bit about healing, what's out there, current research. We got Memorial Day Murph coming up. It's going to be hot, it's going to be sweaty, and a lot of people are probably going to be going for the ice bag after for pain, strains, muscle soreness. So we're going to talk a little bit about that. When we talk about icing, it's maybe my most favorite topic because it's ultra contentious. But it's important to understand how the body heals. So we're going to make this real short and sweet, not get too sciencey with it. And we're just going to compare side to side about what the body's trying to do versus what an ice bag does. And we'll just make a real quick comparison. So the body heals in the same way every time. 3 phases: inflammation, repair, and remodel. So one is inflammation. Looks like that, something like that. 2, repair. 3, remodel. So really the phase in session here is inflammation. If you ask anybody why they use ice, they say, I want to control inflammation, or I want to decrease swelling. So really, these are later phases of healing, and we're really going to focus on this first one because that's what people are after with an ice bag. So this is what the body wants to do. Let's say you tweak the knee or take some type of trauma to the thigh and you've got a bruise, a hot spot there, and your body wants to heal that. The first thing your body's going to do is increase blood flow. So during this phase, we have an increase in blood flow, and then the body's going to dump all kinds of chemicals in that area, and that is what inflammation is. It's a chemical soup of cells that kind of eat up nasty tissue, and the result of inflammation is swelling. So inflammation and swelling are not the same thing. Swelling is a byproduct of inflammation, much like exhaust is a byproduct of your engine burning gas. So the body, you get injured, it increases inflammation and blood flow. That's the first thing it does. These things happen in order, and they happen the same way every time. So the body gets inflamed, all the chemicals it brings in signals other chemicals to come in and repair, and then late phase in healing, the body's going to do what's called remodel, and that's where it forms your scar tissue, and it makes the tissue as normal as possible if you rehab correctly. So body increasing inflammation, increasing blood flow, and so current literature on icing shows us that ice will decrease blood flow and decrease inflammation. So already what the body wants to be doing here and what the ice bag is doing are 2 different things. So at the bare minimum, we can say if your body wants to inflame and increase blood flow, and an ice bag decreases blood flow and decreases inflammation, you're going to slow your healing times down. So the second thing that you got to talk about is swelling. A lot of people use ice to get rid of swelling. It's 100% not even a possibility. Simple fluid dynamics, which state hot fluid flows faster than cold fluid, says if you freeze a joint, the fluid that's in the joint is going to be harder to evacuate out, versus if the joint is hot and loose, it's going to be easier to evacuate that fluid. And so then it's important to understand, how does the body actually clear fluid out of a muscle, out of a joint? It does that through the lymphatic system. The lymphatic system is a system of vessels that parallel your arteries and your veins, and they course throughout your muscles. The only way lymphatic fluid moves is when the muscle contracts, it squeezes that fluid up the extremity. And a repeating cycle of contract pushes the fluid up, and the relax draws more fluid into the vessel through negative pressure. So what we get is you throw an ice bag on, and what the body needs to be doing is increasing blood flow, increasing inflammation, and it also needs to be increasing pain-free muscle activation. All right, so if you have an injury, you don't want to create more pain. That means you're further damaging the tissue. But what we can do is start to activate muscle tissue in a way that's pain-free to start evacuating the waste and the metabolic junk that's been sitting in the muscle or in the joint. So icing is a wholesale, counterintuitive process to what the body wants to be doing. It decreases blood flow and inflammation, which are required for healing, and it places you in a very still position with your muscles not moving and doesn't actually clear fluid, because we know large muscle movement and large vessel pulsation in the body is what evacuates fluid when it surrounds a joint or is kind of in the muscular space. So when we start thinking about going for the ice bag, the other thing people use that for is pain, which is well documented. Ice can reduce pain. But the real conversation is this, is what are you sacrificing for 10 or 12 minutes for the sake of decreasing pain? So you're going to get a temporary pain relief from ice, yes, but are you slowing your healing times down? And really what we're after is, what are we doing to facilitate the body's healing response? How can we maximize helping the body do what it does naturally? How can we minimize things that we might do that slow that process down? So, just a quick recap. The body wants to inflame, it has to do it. If you don't inflame, you don't repair, you don't remodel, you don't heal. Ice slows blood flow and slows inflammation, so we're at the bare minimum dragging that process out much longer than we should maybe need to do that. An example in the clinic is total knee patient comes in, they get ice in the clinic 3 times a week for 20 minutes, and then they ice every 20 minutes on and off at home. They come in 6 months later with a hot swollen knee. That to me screams, hey, something's not working. But using some different devices, which we'll talk about a little later, I've seen a total knee recover completely from swelling, muscle disuse, and atrophy in 4 weeks. And that's pretty common if you help the body do what it's designed to do. So here's the other thing we're going to get into, is a little more on the research. We know what the research tells us that ice does, and kind of the big concept around rehab and what we're doing in the clinic is a concept called evidence-based medicine. Everybody's got the big thing about evidence-based medicine. Are you doing what the research says is most effective? And there's a lot of value behind that. But my statement is this: if you look at all the research on icing, all of them are inconclusive. They say something to the effect of, we need more research studies to really know the true efficacy of icing. And we also know that when you move and muscles contract, it clears fluid. So any icing study that says icing reduces swelling is confounded or made null and void by the fact that patients are still outside of the research study, walking and moving and doing their daily life, which is going to help clear fluid anyway. So my question is this: if we're going to be practicing evidence-based medicine, why are we using a bunch of inconclusive evidence? To go a step further into some of the research about icing and how it's used, when it should be used, is there's really no standard practice. So when we talk about icing a joint, people are so different. You have really big joints, you have really small joints. You have some people with a lot of fatty tissue around their leg and some people who are very, very lean with no tissue whatsoever. And so tissue depth plays a part. And we're just going to take 2 points here. Tissue depth versus how cold. All right? No one has standardized how cold should the ice pack be. And at this set temperature, let's just say negative 10 degrees, at that temperature, how far does that cold penetrate, and is that cold deep enough to target the inflammatory site that you're after? And so there's a lot of missing pieces to this idea that we should be icing our joints, icing our injuries, and that tissue depth is always different, and the skin can only tolerate so much cold. To penetrate a certain depth means you have to have an increased degree of coldness, and there's no research that says based on this tissue depth it needs to be this cold and then it needs to stay on for how long. There's no standard practice to icing, and so it's really difficult to implement and be real consistent with it. On top of the fact that it doesn't work, and why are we still doing it? I feel confident, 50 years from now, an ice bag might be in a like a medical myth museum somewhere, because there are better devices coming out that help evacuate fluid and increase blood flow, and there's more research starting to develop now proving that icing is not doing what we thought it was. It's become so mainstream, it's everywhere, it's $1 million, maybe $1 billion industry, and it's easy to fall into the trap if we do it because we've always done it. But we have to reevaluate the evidence, we have to reevaluate what works, and push towards things that do, and try to get away from these things that we do just because we've always done them. And if you don't believe me, look for yourself. There's good evidence on anything that decreases inflammation decreases healing. And so now it's pretty common in the orthopedic world that when there is a fresh fracture, doctors will not prescribe NSAIDs or non-steroidal anti-inflammatories for those patients, because the research now states that NSAIDs delay the healing of bone fractures. Well, guess what? Bone fractures heal the exact same way as a bruise, 10-inch total knee replacement incision. The body heals the same way no matter what the tissue is. So the evidence is starting to stack up on ice, what it does, what it doesn't do, how we should use it, maybe the fact that we shouldn't use it. And so it's just something I want you to consider. Next time you've got a little pain or strain and think about going for the ice bag or popping that NSAID, maybe let's start to think about some ways that we can facilitate our healing in some pain-free ways without adding stuff to the body in ways that don't make as much sense. So keep your eyes out for part 2 of this. We're going to talk about a couple of devices that can help facilitate healing and evacuate swelling much more effectively than ice. Look forward to seeing you in it.